In the previous video, we talked about the concepts of bonding and adhesion. In this video, we're going to talk further about dentin bonding agents. Basically, dentin bonding agents create a strong bond between the composite restoration and the tooth structure. It adheres to the composite on one side and to the tooth on the other side. In this way, it forms a strong interface between the composites and the tooth structure to withstand mechanical forces and shrinkage stress. This bond between the composite and the bonding agent is created by copolymerization of the bonding agent with resin matrix of the composite materials. But what is copolymerization, you may ask? So we know that dentin bonding agents are solutions of resin monomers. So when the monomer in the bonding agent and monomer in the composites polymerize, they form a copolymer. A copolymer is a polymer that is derived from different species of monomers. This is called as copolymerization. This is the way this bond happens. When we want a restoration to retain in the tooth, we have to give certain features to the cavity preparation like dovetails, grooves, undercuts. This results in loss of sound tooth structure. But when we use dentin bonding agents, it markedly reduces the need to provide such mechanical retention features. In this way, bonding agents help in conservation of the sound tooth structure. So what does a typical dentin bonding system include? It includes etchants, resin monomers, solvents, initiators, inhibitors, fillers, and sometimes other functional ingredients such as antimicrobial agents. So let's start with etchants. Etchants are basically strong acids. When we apply the etching gel, it removes the smear layer and exposes the collagen fiber network. The preferred etching agent is phosphoric acid at a concentration between 30 and 50%, typically 37%. But have you ever thought why 30 to 50 and why not above 50? You see, concentrations greater than 50% results in the deposition of an adherent layer of monocalcium phosphate monohydrate on the etched surface. This inhibits further dissolution, so that's why it's in the range of 30 to 50%. Second component is primers. You can think of primers as the assistants of adhesives. Before the adhesives are applied, primers come and check the area, make it ready for the adhesives, and then help the adhesives to go inside these tiny pathways into the dentin that the etching gels have created. As we have seen, etching of dentin results in removal of smear layer and minerals from the dentin structure. This exposes the collagen fibers. Areas from where minerals are removed are filled with water. This water acts as a plasticizer for collagen, keeping them in an expanded state. In this way, spaces for resin infiltration are also preserved, but the adhesive resins are hydrophobic. That is, they don't want water here. At the same time, we can't dry the dentin surface because if the dentin surface is made too dry, there will be collapse of the collagen fibers. Because of this collapse, the adhesives cannot sufficiently penetrate into the dentin. This will result in low bond strength. So the primers come to the rescue here. The adhesives don't like water. They are hydrophobic. But primers are hydrophilic, that is, they love water. When we apply primer, it helps to maintain an expanded collagen network while removing residual water. Primers know that the adhesives don't like water, so they remove it and help the hydrophobic adhesive resins to infiltrate into the collagen network. 2-hydroxyethyl methacrylate is a widely used primer monomer because of its high hydrophilicity and solvent-like nature. If a primer has the ability to both etch and prime, it is categorized as a self-etching primer. Solvents also play important roles in priming systems. Primers are basically dissolved in these solvents. The most commonly used solvents are water, ethanol, and acetone. What the solvents do is they enhance the wetting of hydrophilic dentin. Each solvent has a specific contribution to improve bond adhesion. Water can re-expand the collapsed collagen network. Ethanol and acetone has water chasing ability which facilitates water removal. So you see, this is how the primers are able to remove water and re-expand the collapsed collagen network. Then there are adhesive resins. For dentin bonding, the primary purpose of adhesives is to fill the interfibrillar space of collagen network. This creates a hybrid layer and resin tags which will provide micromechanical retention after polymerization. In addition, the adhesives also prevent fluid leakage along the restorative material's margin. We know that adhesive resins don't like water, they are hydrophobic. But this fear of water is actually good because that's why they don't allow fluid leakage along the margins of the restoration. At the same time, adhesives require a certain hydrophilicity to diffuse into the hydrophilic primer wetted dentin. So that's why generally adhesive resins are composed mainly of hydrophobic dimethacrylates and a small amount of hydrophilic monomer such as HEMA. Next component is initiators. Both the adhesives and restorative composites need initiators, and similar initiator systems are used in both. Initiators are like triggers which begin the polymerization reaction. Polymerization basically means the resin-based composite goes from a plastic phase to a semi-solid phase. It can be initiated either through a photoinitiator system consisting of a photosensitizer, for example, camphroquinone, through a self-cure system that includes a chemical initiator, for example, benzoyl peroxide, or through a dual cure initiator system. Filler particles. Nanometer-sized silica particles have been added to some adhesives to reinforce the adhesive and thereby produce higher bond strength. But the size of filler particles is approximately 40 nanometers and the interfibrillar space of the collagen network is 20 nanometers. So it's not clear whether these fillers can actually penetrate into the demineralized collagen network. The other reason for the addition of fillers is to make the adhesives thicker in consistency because thick adhesives form a thick bonding layer which can promote increased bond strength. Also, a thick adhesive layer can reduce shrinkage stress. A number of additional ingredients are used with dentin bonding agents for a variety of specific purposes. For example, glutaraldehyde is added as a desensitizer. The monomer MDPB and paraben are used as antimicrobials. Fluoride is added to prevent secondary caries. Benzalkonium chloride and chlorhexidine are used to prevent collagen degradation. Now let's see how dentin bonding agents are classified. Historically, dentin bonding agents have been classified into 7 generations. The first 3 generations failed to provide adequate bond strength to the dentin. There is another classification which is based on 2 general approaches to etching, priming and applying the bonding resin to dentin and enamel surfaces and is further subdivided into number of steps in the process. In this classification, the major categories of bonding systems are known as etch and rinse and self-etch systems with 2 subcategories. These subcategories are according to the number of clinical steps involved. So etch and rinse adhesives include 4th and 5th generation. This is also known as total etch technique. Total etch technique involves the complete removal of the smear layer by simultaneous acid etching of enamel and dentin. After total etching, primer and adhesive resins are applied separately or together. The 4th generation includes 3 steps: an acid etchant application, application of the primer, application of the actual bonding agent or bonding resin. In 5th generation, they have combined the primer and adhesive resin into one step. Similar to the 4th generation, they are based on the total etch technique. They are also known as one bottle or one component bonding agents because the primer and adhesive resin are in one bottle. The basic difference between 4th and 5th generation is the number of basic components of bottles. 4th generation bonding system is available in 2 bottles, one primer and one adhesive. 5th generation dentin bonding agents are available in one bottle only. The second category is self-etch adhesives. It includes 6th and 7th generation. You can see in the 6th generation there are again 2 steps. This approach does not involve a separate etching step. We are using self-etching primer here. It conditions and primes the tooth at the same time. The 7th generation system achieves the same objectives as the 6th generation system, except that they simplified multiple 6th generation materials into a single component. This category combines conditioner, that is the etchant, primer and bonding resin into a single step. So it's a single bottle, one step self-etch adhesive. So the number of steps are minimized. Reducing the number of steps helps in avoiding any mistakes that could be encountered. Recently, a randomized clinical trial showed that one-step self-etch adhesives had similar clinical performance after 3 years compared with that of an etch and rinse adhesives in class 5 restorations. However, the one-step group exhibited more incisal marginal defects and discoloration compared with the etch and rinse group. So how to choose which adhesive systems to use? Remember, it depends on the clinical application. We will see some general recommendations for specific situations. For bonding composite cores, 4th generation systems are usually recommended. For bonding anterior and posterior composites and cementation of veneers with resin cements, 5th generation systems provide the best performance. For bonding posterior composites, 6th generation systems are the better choice. Dual cure one step 7th generation systems are advised for aesthetic posts and ceramic restorations bonded with resin cement. Light cured one step self etch 7th generation systems are recommended for bonding posterior composite restorations. So that's about Dentin bonding agents. Remember to watch the bonding and adhesion video to understand more about adhesion. It's a fun video, not boring at all. So please do watch it and I'll see you very soon. Bye.